Good afternoon, ladies and gentlemen. Welcome to UNEP AIT webinar series on COVID-19 and plastic pollution. What did the region learn? It's a reflection from the last 1 year of pandemic. Let me start first a small word on the webinar series we had on 26 February 2021. It focused on South Asia. And today's event, we call the webinar number 2, going to focus specifically on Southeast Asia. I'm happy to say that we have more than 350 participants who have registered, and we have an excellent 7 eminent speakers and extremely rich information on different aspects of plastic pollution. But we have 7 eminent speakers, but each one is given a very limited time. Each one try to present their views within a short 10 minutes. But I'll assure the participants, all of you will get their presentation PowerPoint slides after the webinar series, so do not worry about it. And participants, please keep the chat line on so that you could continuously ask questions, and all the resource person have agreed they will try to answer all your questions if possible at the end of the Q&A session, or as a post webinar reporting, they will provide you an answer. So please do make the best use of this event. Okay, let me come to my main part of the thing. Let me invite Dr. Mushtaq Memon, who will give the opening remarks and keynote on circular economy to address plastic pollution, specifically in Southeast Asia. Dr. Mushtaq is the Regional Coordinator for Resource Efficiency in Asia Pacific, located at the UNEP Regional Office for Asia Pacific, located in Bangkok. Dr. Mushtaq is the Circular Economy Group.
Thank you very much, Professor Vishu. So, distinguished presenters and participants. Today, as Professor Vishu already mentioned, that we are in the second series of the webinars on addressing the COVID-19 plastic pollution. So as we see, okay, thank you. So since we are in the COVID-19 pandemic situation last year, then United Nations Environment Program under the leadership of the Executive Director Inger Anderson immediately came with a response, what we call working with the environment to protect people. And in this way, we had 4 responses. And number 1 is more focusing on the humanitarian emergency phase and medical, and that includes the COVID waste as well. Now, the whole focus under this one was that while we are protecting the people, we have to ensure that is a sustainable in the longer way. That means our protective equipment, masks, gloves, and everything are properly used, properly collected, and so they do not create further harm to the people and environment. So then also, if you look on the response to the transformational change for nature and people. So again, this change, as we see the ecosystems are being affected by the plastic pollution and marine litter, whether it be the ecosystems on the land or in the marine environment, the point was that how we can abate the plastic pollution on land and in marine environment. And then response 3, investing to build back better. That when we are getting out of the COVID, we are opening up our economies and so on, tourism. Are we going to go back to the same practices where we had a huge amounts of plastic pollution? or we can rethink to build back better, or we call the green recovery. The last response, modernizing environmental governance, as we have seen that the United Nations Environment Assembly had a resolution in 2019, and then also the 5th UNEP 5.1 this year, we had the progress report to look on the plastics pollution and marine litter. We have seen that the world is coming together. Now, plastics are also getting the same level of response in the governance as the climate change and other planetary challenges. So that's where we are thinking that when we are talking about the COVID-19 response, the plastic pollution becomes one of the top areas. And as my other colleagues who will follow with the presentation, they will talk more on the data, but we know the plastics is huge. And in the COVID, again, with the different, because of the e-commerce, the food at home deliveries, the mask, everything, they are huge. And then most of the plastics are not recycled. Most of the plastics are not properly managed, and they end up in littering the land and sea. And that's where we saw that this pandemic brought additionalities with the PPEs and so on, and the way we are having our lives at home in the lockdowns and so forth. The plastic, though other waste might have decreased, the plastics increased rapidly during this pandemic, and that was the major challenge for that. So when we look at the solution side, so one is the cause, why plastics are increasing. Again, when we see our consumption patterns, our disposable incomes, our middle income classes, that's increasing. Economic activities are there. So basically, there's a lot of consumerism, and that directly proportional to the plastic consumer. And then we also see that there's still the linear economies, that you extract resources, manufacture the products, use, and dispose. So there's no circular supply chains in the society yet to close the loop. And then also we can see that all the stakeholders, whether it be the governments, international agencies, private sector, civil society, they are not yet fully integrated to come up with a solution on that. So that's where we are thinking how to create impactful actions, that how we measure, how we monitor what is happening. That's the benchmark to start with, and how we plan, how we make the policies, how we strategize our ways that our economic growth, social, everything goes hand in hand with the environment. And then for that, we need to look on the innovations and solutions, because without innovations, innovative thinking, we can't get it there. And number two, we have to invest in the green solutions, in the innovative solutions. We have to reorganize our financing mechanisms and so on. So when we look on the global and regional instruments, we under the pollution hat, we have quite many conventions, we have quite many agreements, and we have quite many platforms and so on. Then when we look on the biodiversity and species, again, we find international conventions, we find the conventions that, which cover both land and sea, some specifically on the sea, and then the chemicals and waste, again, lots of a series of number of conventions, agreements, protocols, and so on. So that is, instruments are already there. It's not like there. How to implement that, that's the main question mark. And then one of the side for the implementation comes from the sustainable lifestyles. And that's where the consumption is focused, that as a consumer, if we change habits, the producers will follow the path. So that is very important, that how to ditch the disposables, because disposables are the biggest challenge for the plastic pollution rather than the long-term plastics, which we have to again also think properly. But the first important point is the how to ditch the disposables. And you just think how many disposables we use every day, from the wrappers, from the straws, from the cups, from the packaging, you name it. And then with the COVID, again, this additional disposables because of some of the fears, also the overpackaging, the sanitizers, again, and so a plastic mask, and so on. So there was additional T or alpha that came into with the COVID-19 on that. So the important point is that to campaign for that, to change the mindset, to bring everyone on board, and that is for that, information is the key, always. Motivation through peer pressure, through incentives, through influencers, and so on. And then also the opportunity. If there is an opportunity, we act. So we have to create the opportunities to act for that. And that's where UNEP has a huge platforms for sustainable lifestyles, and including on the plastics, to look on that how we can have a good life without plastic pollution and so on. So for that, the priorities we are discussing consumer producer interactive platforms, that how consumers and producers can come on the same page to reduce the plastic pollution, how we do the nudging to come up with the alternatives and so on, and how we create quality of life. We go rather better quality of life by ditching the disposable than downgrading the quality of life. So for that, we have to rethink, reduce, reuse, and recycle, and with the proper awareness raising. And finally, just as we continue to have our low carbon lifestyle challenge every year with this, for the startups. So this year, again, yesterday, we launched the new call, and this is the Asia Pacific Low Carbon Lifestyle Accelerator for the 2020-22, where we are inviting all the young innovators to come and also to look on the plastic pollution solutions. Thank you very much, sir.
Thank you very much, Dr. Mushtaq. It was a very nice and a very interesting presentation. Thank you once again for capturing what UNEP is doing to handle this huge plastic problem, especially during this pandemic. You brought out the important issue of public, private, and community, this triangular approach, and especially how you could have impactful actions from UNEP point of view. Thank you very much. Let's move to the second presentation. The second presentation is on overview on plastic waste management during COVID-19 pandemic, especially in ASEAN. And this will be presented by Dr. Kojima, who is currently attached with the Regional Knowledge Center on Marine Plastic Debris with area, which is in Indonesia. His office is located at Jakarta. The floor is yours, Dr. Kojima. Please go ahead.
I will talk about the overview on plastic waste management during COVID-19 pandemic in ASEAN. Especially, I focus on the plastic waste generated under the COVID-19. At first, I'd like to talk on the factors to increase the plastic waste generation and factors to reduce the plastic waste. Can you see it, or?
Yeah, we can see.
Okay, good. So of course, as Memo-san mentioned, we observe the increase of use of personal protection equipment, and also increase of the demand of food delivery services, and some kind coffee shops ban the reusable cups to provide their products, so that may increase also the plastic waste. And due to cheap oil prices, the price of plastic drop. So cheaper plastic may result in lower demand of recycled plastics. And due to lockdown, industry using recycled plastic stopped operation, and the critical waste may increase due to COVID-19. On the other hand, there are some factors to decrease plastic waste. Due to lockdown, generation of industrial waste and office waste decrease. For example, in Jakarta, they observe the 40% reduction of the waste during the stay-at-home period. And due to decrease of inbound tourist waste generated in area where tourists stay may be decreased. And also due to economic recession and unemployment, waste pickers may increase, more recycled waste may be collected. It is not so sure, but yeah. And also due to decrease of the number of patients due visiting hospitals other than COVID-19 patients, critical waste not related to COVID-19 may be decreased. And Emma-san already mentioned the increase of plastic waste due to COVID-19, especially the personal protection equipment. And one of the newspaper articles mentioned that Indonesia's health ministry acknowledged that problem, saying 1,180 tons of COVID-19 medical waste was generated across the country in Indonesia from March to June. So there are such kind of the observation. And also, I checked the trade statistics about the masks and the gloves, plastic gloves, and it looks the ASEAN countries increase the import of PPE. And probably these countries also produce masks and gloves and so on. And we can also observe a kind of the potential kind of impact to the ecosystems. The masks are found in beaches and the ocean, and also one of the monkeys have been spotted chewing the straps off old and tossed aside masks in the hills outside Malaysia's capital, Kuala Lumpur. So a potential choking hazard for diminutive monkeys. So in ASEAN countries, we can observe such kind of the potential impact to the ecosystems. There are possibility of using the usable masks. Before that, some research found that the kind of the, the effectiveness of non-woven face mask and woven mask and written mask and face shield and mouth shield. And this research found that non-woven face masks, which is disposable mask, our single-use masks, is very effective to prevent the droplets split out and sucked. But some washable masks with high effectiveness have been developed. One of them has 3 layers, which I use. The outer layer is woven polyester, and the middle layer is non-woven propylene, and the inner layer woven polyester. So it's washable, which also use the non-woven layers. So if we can use such kind of the washable mask, it's also effective to prevent the pandemic, and also we can reduce the waste of plastic mask. And reduction of tourists, we do not have much data on the inbound and outbound tourists in the region in some countries, but we observe the inbound data from national international organization, and also we can have some newspaper articles on the inbound tourists in ASEAN countries. So as shown in the tables, Thailand or Singapore, Philippines had a huge kind of decrease of the inbound tourists, which may generally have an impact of the reduction of the waste generation in some tourist spots. Like, for example, the Pattaya in Thailand, they saw the 55% reduction of waste. We have such kind of the reduction also under the pandemic. And this is a kind of retail price of the plastic waste by the junk shop in Thailand. They reveal the kind of a price of the buying price of the plastic waste. And this figure showed that from the March to August or September 2020, the plastic waste price dropped. So it indicates the demand of plastic waste limited. So the junk shop reduced the buying price. But after October 2020, the price is getting back. So the demand of the recyclable plastics is getting back from the fourth quarter of the last year. In some Southeast Asian countries, waste collection services are not well provided in urban squatter settlements of megacities and in middle or small cities and rural area. So we should expand the waste collection services. And also we can observe the open dumping in ASEAN region. And the open dumping site may be one of the sources of leakage of plastics to the environment. Plastic waste and the microplastics may be blown away from by the wind or leaked by rain and ended up to the ocean. So we should expand waste collection services in the region, and also proper disposal of the waste, which can also reduce the risk of the infection of COVID-19 from the waste. So we need a kind of expansion of waste collection and proper disposal. And regarding personal protection equipment and risk of infection from waste, it may be difficult to reduce use of some plastics, such as the PPEs and the packages of food delivery services. But we should be aware of the risk in recycling and waste management. So science has found half of the COVID-19 on plastics was gone after about 7 hours. And informal waste collectors by any means are not equipped with PPE to collect waste, so that the risk to be exposed by virus is higher. And to prevent infection from plastic waste, which may be contaminated with COVID-19, used PPEs should be disposed with securely tied garbage bag. Waste collection workers should use PPEs such as masks and gloves. It may be better for the recycler to keep collected plastic waste for a few days before processing. So that is end of my presentation. Thank you very much.
Thank you very much, Dr. Kojima. Quite nice and very interesting presentation where you captured what's happening in terms of plastic waste management during this pandemic, especially in the perspective of ASEAN. And once again, thank you very much for sharing some data. It's very important. We need to have some data, and you shared this data. One of the interesting points you pointed out was everybody contributes approximately 1 kilogram of plastic waste related to a mask per year. That's quite important for us to know this one. Let us move to the next one. The first two presentations focused around the overview of plastic waste management. Now let's move to the very sectorial one. Then we'll move to the next presentation on the plastic waste coming from e-commerce, especially food related to e-commerce sector. And it will be presented by Ms. Chang, who is a regional head marketing strategy and social impact from GrabFood Singapore. The floor is yours, Ms. Chang, please go ahead.
Thank you very much. Let me share my screen. Okay, great. All right, so I only have 5 slides, so I'll try to make it quite quick and condensed. Thank you for the introduction. I currently, I was heading marketing for Malaysia, and then now I lead the regional level for GrabFood marketing, as well as sustainability and social impact for all 8 of our countries. But GrabFood, as an introduction, is only available in 7 countries across Southeast Asia. We are not in Cambodia, which is our 8th country. And what happened during COVID was that obviously you notice a lot of lockdowns happen, food traffic naturally dropped at our F&B restaurants. At least 60 to 80% of their food traffic income has completely been wiped out as during lockdown, right? And also many people have lost their jobs and their income source. So during this period of time, GrabFood helped digitalize all these businesses and support livelihoods. These are some, to give you a sense, in just the first few months of COVID last year, mid-March, April timeline, 78,000 new merchant partners. That's what we call our F&B partners. They got onboarded onto the GrabFood platform across the region. And a lot of these guys are actually coming as like, first timers. And a lot of them are also very traditional business, whether they're hawkers, they're wet market sellers, grocery stores, they started coming on board. And the good news is during this period of time, a lot of customers also started buying things online, and therefore they saw a 21% increase in online revenue. And we also supported, the driver delivery partners who came on board because they lost their income source and jobs. And we obviously launched, contactless delivery, cashless payment, and try and minimize the risk. Now, back to the main topic around plastics, right? So during this time, the government started, even though economically it is very, very bad, and they are all trying to contain the viral transmission, but we got reached out by a few governments, namely the Indonesian and the Thai government, and they are actually very concerned. So with the Jakarta ban on plastic bags, we helped them to educate all our merchant partners to actually convert from using plastic bags to either paper bags or nylon woven bags that people can reuse. With Thailand, we are still in discussion. I think they're still sort of like planning their whole roadmap, what to do with this industry basically. So what we did, our journey started about 1.5 years ago, late in 2019. We started with a no single-use plastic cutlery. So you'll see this little toggle here as and when you order GrabFood. And in just the first 6 months, we managed to save like 95 million sets of plastic cutlery across the region. We will be releasing a new set of data this year as we release our annual social impact report. So do look out for that. And I think what's more important is actually what are the challenges and progresses that have been made right on this front. So even such simple thing as like, a toggle, and in the receipt, we clearly say, like, do not include cutleries in this order because we have automatically opted every customer out. Like nobody actually gets cutlery unless they choose to come in, right? And still a lot of customers ended up having quite poor experience, especially at the beginning, because like it takes a lot of training, and then the employee turnover happens after you train them, and like people just generally sometimes don't read very carefully, and then they pack them, right? But I guess fortunately over time now we are starting to get less and less of these complaints, because I think people are starting to get more aware, as well as the restaurant owners themselves realize, hey, actually I can save costs with this. So this experience is I guess getting better as we progress. Now, moving on to food packaging. So we did two things. The first is actually we really wanted to try to change or make as many restaurants as we can on our platform. And we have like, a lot of restaurants, right? And a lot of them are still using plastic, styrofoam, whatever. And we wanted to get them to, hey, change to, paper-based, bagas, whatever, more sustainable, because especially outside of Singapore, obviously we know the landfill and the waste management is not so good, right? So how do we minimize the time of the waste on the landfill and try to not use plastics? The very unfortunate truth is even after we use all our leverage, our economies of scale, we negotiated with all the suppliers and partners, and we said, give us at least 20-30% for any of our merchants. It's a special discount, right? The truth is the take-up was very, very low, because no matter what, even after the discount, it's still 4 to 5 times more expensive than plastic packaging. So imagine if they have been buying at 3 cents, now they have to pay 15 cents, and they're not really willing to do that. So that's like reason number one. And then the second reason is that we also found out that our type of food, the Southeast Asian cuisine, a lot of like soup, a lot of heat, it is not really suitable for this kind of packaging, which is more made for like, single items like a dry, like, a salad or burger. If you imagine, like we also serve a lot of like Indian food, and they have like small little curries and stuff, then this would be really tough, right? Very challenging to provide so many, and it's so expensive anyway. So that's number two, the lack of available designs with our food in mind. The third being actually the restaurant owners are also very, very unsure, and there's so much of greenwashing by the vendors. It's not funny. Like I've met so many who tell me PLA is the way to go, right? And then when we ask them how is it being dealt with at the landfill, right? Because all these countries obviously they don't have compostable machines, and they say, sorry, I mean, you got to compose them. But obviously as a restaurant owner, they don't have time for all of these things. So they believe what they are being sold, whether it's PLA, biodegradable bags, or, plastic line, paper box, bagas. They have no idea what is actually good or not. They just think, it says plant-based and it's good. Very unfortunate. The last point being, actually, there's no real rush in their opinion, because they feel like, for example, Singapore hawkers, they still serve it in styrofoam because they feel like, why? The government's not asking me to do it. My sales is still coming in. So even though we encourage and push them, nothing much has it's not very, very scalable at this moment. However, I mean, I have some sort of good news that we recently ran a real life experiment in Singapore, in the heartlands of Singapore, all these places like Ang Mo Kio and Jurong, if you're familiar, with hawker centers. And we said, like, look, you don't have to subsidize any of these costs, right? You can just list it in your menu, and then let's see what the take-up is. And we gave them the containers for free just for the first batch to try. And 1 out of 4 customers actually paid that extra, like 30 Sing cents, and we were like, wow, that's incredible. I mean, people are starting to change the behavior. And then for the merchants, the hawkers who took it, they were pretty convinced, and they continued thereafter, right? So we are, trying all these experiments and trying to educate more restaurant owners as we go along. But it's a painful journey because of all these reasons. Now, The reusable containers, another very big, very interesting project that we are really trying to figure out how to scale this. Again, another very, very difficult topic because of the whole process. Right now, we have more than 100 outlets, 100 restaurants that have this with us. We have partnered with Muse, Bearpack, and we even did some of it ourselves in Indonesia. So we have experience partnering and doing ourselves, right? I think one big topic around reusables is the hassle for consumer, because our business is built around convenience. So when the customer has to book, and then after that, after eating, has to rinse, and then have to return back to certain restaurants, or even when we give them drivers to return to, the rate of returns very, very low. And interestingly, I think we did some surveys to try and understand, and they said like, hey, actually the container quite nice, right? I want to keep it for my kids. That's one. But the others are just like, I'm too lazy. I don't really want to go through all this hassle to return and stuff. So on the consumer front, that's what it is, right? And for the restaurants also, not easy for them to adopt, because they got to think about storage space. Last time plastic, you stack everything in and done. This one's a little bit harder, right? Because it's more bulky. So, and a lot of them run like small space restaurants. So they can't keep it in big quantities anyway. And then they got to think about cleaning. They got to think about the staff training. And then, again, back to like, actually a lot of them also told us like, why bother to go through all this hassle? Nobody's actually forcing us to do any of this, right? So that's another barrier we're going to come. And again, back to my point, actually, all this packaging is not suitable for our Southeast Asian cuisine. And the last one is what we found out was when we launched it right before, we launched it in Bali in January, right before COVID. And then when COVID hit, nobody wanted to use this because they were super concerned about like, whether it was washed clean, not clean, and all that kind of thing. So that's what it is. So very quick summary, the thought around like what we are doing now, we give this voluntary, we give customers a choice. It is a voluntary adoption, but it is not enough. We definitely need cooperation with governments, packaging vendors, material solution support, to actually make this needle moving, right? As one of the earlier speakers said, innovation is super crucial. And the problem to solve, if I were to summarize it, we really need to get merchants to try to adopt it, because we can't force them as a platform. And all these problems are the key things, right? Economic viability, design issues, no urgency, because there's no regulations or no customers demanding for it. But for us, we will continue, to support and promote and encourage and seek solutions. Actually, we are seeking solutions for both single-use waste as well as greenhouse gas emissions. And so I thank you for your time and for listening. Just saying that, if anybody out there feels like they have solutions that they want to partner with us, test it out, even though it's early stages, we are super open to it. So please reach out to me. Thank you.
Okay, thank you very much, Ms. Chang. I think food e-commerce is one sector demonstrated remarkable growth during this pandemic, but at the same time at the cost of generating huge amount of plastic. I think your presentation clearly pointed out, although the e-commerce sector has been, food commerce sector has taken a lot of initiatives, but we are not able to get tangible benefits and outcomes. It's a difficult task. Thank you very much. Let's move to the next sector. We're going to have two presentations from the healthcare sector. The first one is COVID-19 and healthcare plastic waste management, a case from Philippines. It will be presented by Mr. Ramon Pascal, who is the Executive Director of Healthcare Without Harm. It's an international NGO. I think the floor is yours, Ramon. Please go ahead.
Hi, good afternoon, everyone. Thank you for this opportunity. And let me just load my slides. I hope everyone sees it. Again, this is a very timely discussion Now, I want to focus on the hate, healthcare waste management as being part of the mission of healthcare without harm. Now, just to be a bit of a background, we are managing a global network of hospitals we call as GGHH, or Global Green and Healthy Hospitals Network. And among the 10 sustainability goals of this network, if you would see on bullet 3, is waste. And in the context of Southeast Asia, this is the biggest concern among hospitals, even before COVID, and how much more now. Now, before COVID, 2017, 2018, we've started looking into the plastic dimension of the waste problems and issues in hospitals. We audited hospitals in Indonesia and in the Philippines, presented this in a global conference in Bali in 2018. And as you would see in the slides, a typical hospital, whether Indonesian or a Philippine hospital, would constitute about 60 to 70% of plastics in their waste stream. This is again before COVID. Now, what sort of plastic can you find in the whether it's the green bag or the yellow bag or the black bag? These are as typical as what we dispose in our homes. For example, drinking bottles, or in our offices, PET bottles, foodware. Of course, there are medical plastics, a lot of packaging, sanitary items, and toiletries. Now, as part of the whole summary of the audit that we did before COVID, we already came up with a plastics toolkit for hospitals. And at the bottom, towards the end part of this whole manual, about a 50-page guidance document, we came up with top 10 prescriptions for hospitals to reduce or minimize harmful plastics in healthcare setting. Among them, I won't read everyone, but just look at number 1, for example. From the audit that we did, we saw that there are so much single-use plastic products that should be easily changed or altered with a more sustainable replacement. So products such as disposable knives, spoon, forks, straws, clamshells, PET bottles, sachets, wipes, blister packs, even shopping bags, these are all can be addressed. Now, in number 8, for example, one of the ways that hospitals that were audited have resolved the issue of so much plastic bottles in their waste bags is that they install water stations across hospitals, educate their staff, and even incentivize bringing a reusable water container, such that soon PET bottles are gone in their waste stream. Now, and yet, COVID hit us in 2020. For some of the green hospitals that we work with in our network, they immediately went to work. They saw that there is a very serious shortage of PPEs, that it is very expensive, and it is very damaging to the environment. So some of the hospitals, and the picture you see here is from the Iloilo-based St. Paul Hospital. They begin developing and manufacturing or sewing their own PPE that is both washable and reusable. And after a year now, when we see the figures, they are able to save by the millions of pesos from just shifting from disposable PPE to reusable, washable PPE. Healthcare Without Harm also produced several guidance documents or illustrations on how to manage better waste coming off from COVID-19 or from the pandemic. Now, part of what we were doing even before COVID, as I said, is to audit hospitals and show them how can they reduce plastics and how can they reduce overall their waste. But when the COVID happened, we shifted the context of the audit. For 5 hospitals that are being run by our Ministry of Health in the Philippines, but still it is meant to qualify and classify healthcare waste generated in the time of COVID, analyze its plastic composition, and develop recommendations and resolutions that can be acted upon both by the hospital and the ministry itself. Now, we need to change the approach in the auditing as before we have no fear. We open bags, we weigh them, we analyze the content of every bag, including infectious waste, or what you call as the yellow bag in hospitals. But we need to adjust. One, we need to focus on where are the most COVID waste are generated. So this is the ICU, medical ward, ER, and the dietary department. We did not open bags anymore. However, we went to the inventory review. To replace counting and qualifying the kind of waste inside bags, we went to what is in their supply room and what is being supplied in the ICU, in the medical ward, and how fast is the turnover. So more or less, we have an idea of what are those wastes in the bags that we cannot open anymore. And supplies used shall represent waste present in the trash bins. And we audited 1 week amount of waste during the time of COVID, particularly from the period of October, November, December last year. What I will cite now is one particular hospital among the 5 that we audited in the Philippines that are in the front line of COVID treatment. And these are all in the National Capital Region. And Philippines, as some of you may know, is one of the Southeast Asian countries that has the most cases. And up to now, we're still lingering in a long, overdrawn lockdown because we cannot manage the increased cases of COVID. But this particular hospital happens to be a green hospital. I mean, their leadership is meant to address not only public health but environmental health and combine them through energy efficiency, plastic waste management, food and nutrition, greening of the hospital, and replacing the disposable with reusable. So it is a leadership that is enlightened and yet have to reckon with the realities of COVID. This is their plastic production, waste production before COVID. You can see there 36 and 64%. Plastic is 64%, non-plastic is 36% before COVID. And that's and you can see there the classification of plastics that were collected. Now, just to summarize, now that we audited this particular hospital, we helped them, we trained their people, we adopted a particular methodology that is COVID sensitive, such that people are protected. What are the key findings? And I just need to highlight for the time that is left for me to report. I will highlight few of the findings. First, together, plastic food containers and foodware account for 46% of the plastic items counted in the audit. Meaning, if you think of hospitals and you imagine, for example, medical plastics, this is not necessarily the only plastic that is being dealt with. Those in the cafeteria are a serious component of the plastic waste coming off from hospitals. Gloves are the most used plastic item in the medical ward, followed by syringes. Now I'm raising a point here. Gloves present a very toxic plastic waste component in all hospitals. This is not only the Philippines. This, as a global NGO, we realize that gloves pose a serious threat in terms of plastics pollution, and we need to find way to address this. part of the key findings as well, again, if you talk about PPE as the robes that we wear, the mask, the face shield, still gloves comprise most of the PPE used in the hospital. And then more than half of the PPE items supplied in all departments directly involve patient treatment, meaning where serious and numerous cases of COVID is happening, then you have more serious volume of waste generated, simply because the PPE items alone are directed towards those that are treating patients, the ER, the ICU, and the medical ward. Therefore, the fear of trade-off is really happening between safety and exposure to health hazards against reduction of plastic waste, which is a resolution of this hospital prior to COVID. This is now a real concern that has to be balanced. And certainly, being cautious and being safe becomes a dominant determinant in addressing this balance. More on the findings on waste segregation. The high proportion of infectious waste produced per area suggests poor segregation. Now, this is not to diminish the efforts of the hospitals, but in all hospitals that we audited, COVID or pre-COVID, segregation is always an issue. We always find PET bottles that are in the yellow bags, and yellow bags are the infectious waste. And yet, these are just the PET drinking bottle. And we always find food waste in the yellow bag. The moment you put stuff in the yellow bag, then that represents cost. That represents that waste will not be properly processed anymore. And that also represents extreme environmental harm because of so much plastic being injected or inputted into the hazardous or infectious waste bag. And therefore, that requires training, both in the leadership and among the staff of the hospital. Now, therefore, to summarize, looking into the audit experience and the COVID context, what is the impact, therefore, of the pandemic? One thing that we are seriously presenting as key message here, most of the waste that are not necessarily classified as infectious go to the infectious waste. There is an overreaction such that anything that has to do with COVID is considered infectious. Now, this is also now coming up into the vaccine. And this is where I think this discussion should also consider the vaccination campaign. The other thing is that initiatives to use reusable materials may have been halted because of the pandemic. You can imagine cafeteria and hospitals that used to have washables. Now, they got rid of their washable stuff like plates and glasses, and everything now is disposable. Is it necessary? We would argue no, even if it is pandemic.
Ramon, can you wrap it up, please?
Yeah, this is the last item. The use of the plastic cover to help minimize COVID-19 spread, increase plastic use. There is no disposal place for those big, thick, single-use plastics that are being used to divide different areas of hospitals in the front line of the COVID. So therefore, we bring up several recommendations, such as review the glove use, involve infection control committee, determine sustainable alternatives like PPE. There are indeed ways of replacing PPE, not with disposable every time, but with reusable and washable. And plan for safe and sustainable disposal of COVID-19 vaccination waste, particularly in this period that we are already rolling out vaccines. Thank you very much.
Okay, thank you very much, Mr. Ramon. I think it's an excellent example of plastic waste management in hospital, and thank you once again for sharing a very interesting data. Let's move, considering the time constraint. Let's move to the next presentation on the same thing on COVID-19 and plastic healthcare waste, the challenges and solution, and where Dr. Terry Thompson will make the presentation, and it will be a little bit of a macro analysis. Dr. Terry Thompson has worked with WHO as a regional consultant for a long time, and is a very good close friend of AIT. We worked extremely closely on different issues. So let me give the floor to Terry now. Please go ahead, Terry.
Greetings to all participants. Before I begin, I would like to just thank AIT and UN Environment for this opportunity to speak with you all on this important topic. Let us start our talk with the outbreak in Wuhan, China. Healthcare waste volume has quickly multiplied almost sixfold in Wuhan during the first few months of the outbreak. The authorities there recognized the need to safely manage healthcare waste in order to protect the wider community, as well as patients and healthcare workers themselves. Because although healthcare waste typically contains a lot of non-hazardous material, it also contains infectious agents, sharps, chemical waste, and may even contain radioactive waste. Wuhan managed the situation effectively with strategic use of stationary and mobile disposal units, mainly incinerators, also with co-processing of healthcare waste with municipal solid waste, again, that was mainly through incineration, and transport to neighboring cities for processing. This too was mainly through incineration. What was the experience elsewhere in Asia? Well, very little published data are available at present on waste generation rates during the pandemic. This slide shows some data, which I've been able to gather from various sources. As you can see, the figures vary very widely, and the reasons for such large variations are not yet explained. The World Health Organization foresees a comprehensive report on healthcare waste management during the pandemic sometime next year, in 2022. At that time, we will have a better understanding of how the pandemic affected the generation of healthcare waste and its management. But WHO does not have a good handle on this yet. Here we take a quick look at Indonesia, a large middle-income country. Indonesia's short-term strategy is to accelerate the licensing of hospital-based incinerators. In the medium term, Indonesia plans to construct central incinerators for healthcare waste in 5 provinces. No doubt there is a sense of urgency here driven by the pandemic, but some may express concern over the environmental impacts of incinerating healthcare waste, which typically includes large quantities of plastic. Plastic products cause environmental impacts both when they are produced as well as when they are disposed. Incinerating plastic causes emissions of greenhouse gases and a number of toxins, which together contribute to global warming, as well as the pollution of air, land, and water resources. Similar impacts result from the very production of plastic, which itself is derived from petroleum, and whose production depends on the combustion of fossil fuels. At the other end of the spectrum, we have a country like Laos, PDR, which is a low-income country, relatively small in terms of size and population. Laos Ministry of Health has launched the Safe, Clean, and Green Hospital Initiative, which takes a comprehensive approach to address a broad range of environmental issues in hospitals, including promotion of the 3 Rs. 62 hospitals currently participate in the Safe, Clean, and Green Hospital Initiative. Laos' national healthcare waste regulations require segregation of waste at source and recycling of materials, and ban incineration of healthcare waste in central and provincial level hospitals. What I like about this approach is that emphasis on segregation of waste and on recycling and the ban of incineration. But I also like the idea that rather than treating healthcare waste as a vertical program, it is integrated as an element of a wider program aimed at making hospitals safe, clean, and green in every sense of those words. Now, let us do a reality check. It is often stated in the literature that up to 85% of healthcare waste is non-hazardous, but is that always true? This slide shows the findings of waste characterization study in a general hospital in Vientiane. In principle, 73% of this hospital's waste should be non-hazardous. But because of poor waste segregation practices at source, the non-hazardous portion actually drops to only 50%. You see, the moment that any infectious or other hazardous waste is dropped into a bin containing general waste, the entire contents of that bin must be considered to be hazardous. This happens frequently in many healthcare facilities throughout the region, and it creates an obstacle to recycling. How important is it that hospitals should practice good segregation of waste at source? Firstly, let us consider that up to 70% of a hospital's waste may be plastic. That was the finding of a study by the NGO Healthcare Without Harm in 2019. That was pre-pandemic. Now, because of the pandemic, even more plastic is entering hospitals' waste streams. Wherever there is poor segregation of infectious waste from general waste, the result will be that large quantities of plastic are mixed with infectious matter. This creates an obstacle to recycling of plastic. Plastic that has been mixed with infectious waste can only be recycled if it is first sterilized. Let us now consider WHO's guidance on this matter. WHO has issued a guidance note addressing wash and waste in relation to the pandemic, and a few important points may be mentioned. Firstly, there is no evidence that handling healthcare waste has resulted in transmission of COVID-19 anywhere. Waste from COVID-19 facilities is no different than waste from any other healthcare facility. And the conclusion is that additional measures are not necessary beyond WHO's standard guidelines for safe healthcare waste management. WHO, together with other agencies, has issued this decision tree for treatment of COVID-19 waste. This may be difficult for participants to read, but it starts at the top with the segregation of non-infectious waste from infectious waste at source. That is fundamental. From there, the preferred treatment option is on-site treatment using best available technology, which we will speak about in the next slide. If that is not possible, the second option would be best available technology in a central treatment facility, and so on down the line. There is a lot of detail here that we do not have time to go into in this webinar, but participants can study the diagram more carefully when they see the handouts. Now, according to WHO, the preferred treatment technologies are autoclaves or high temperature double chamber incinerators. However, I want to make a point here about these two technologies because there is a lot of disagreement among practitioners regarding which technology is more suitable for developing countries. Personally, I've seen in the field quite a number of incinerators installed to support immunization programs, and autoclaves that were installed during the avian influenza and swine flu pandemics a few years ago. Many of these units quickly became inoperable due to poor operation and maintenance practices. Today, they are useless. These are wasted capital investments. And I say shame on us all if we repeat those mistakes in responding to the COVID-19 pandemic. We face a serious challenge to put in place systems to ensure sustainable operation and maintenance of facilities over the long term. And that is a fundamental need regardless of which type of technology is employed. And this is the point that I would like to emphasize. Here, I would like to make a few recommendations for management of plastic and healthcare waste during pandemics. For hospitals, it is fundamental to train all healthcare workers and strictly implement waste segregation at source. Secondly, I would recommend that hospitals consider sterilization of wastes over incineration. That is in order to reduce environmental impact. But either way, take steps to ensure sustainable operation and maintenance of the treatment units. Thirdly, please consider reusable PPE. Reusable PPE is available on the market. I think another speaker has addressed this. And it is more economical over the long run. Of course, it must be properly cleaned and disinfected prior to reuse, but reusable PPE can significantly decrease the amount of plastic in the waste stream. For households, we should encourage the use of reusable face masks. These also must be cleaned and disinfected periodically, but they're economical over the long run, and they help to reduce the amount of plastic in municipal waste streams. If single-use masks or gloves are used at home, they should be destroyed before disposal in plastic bags, enclosed and tied tightly, but they should be destroyed in order to prevent possible reuse. In the medium to long term, hospitals may consider other recommendations. Again, I come back to the point that hospitals should strictly maintain waste segregation at source. I cannot repeat that often enough. It is so important. Hospitals should conduct healthcare plastic audits. Healthcare Without Harm, as you know, has an excellent toolkit to assist hospitals with doing that. And on the basis of the audits, develop and implement strategies to reduce, reuse, and recycle plastic waste and other recyclable wastes. In the long term, a longer term strategy may be to develop a comprehensive healthcare plastic circularity strategy. But the important thing that I think to keep in mind is to get started by doing something. In closing, I wish to acknowledge colleagues who contributed information for this presentation. Their names are shown here in this slide. And I thank everyone for their attention. Thank you very much.
Thank you very much, Terry. Once again, thanks a lot for sharing your long-term experience with WHO, especially on this region. Also, your presentation specifically highlighted the importance of classification of the waste and also the importance of waste segregation at source. Okay, let's move from health sector. Now let's move to the packaging industry. So we are going to have a very interesting presentation from plastic management from industry sector, how it's going to happen. So here, the sustainability in plastic packaging in post-pandemic, what is the industries doing or planning to do? This presentation will be by Dr. Patra Manisin, who is currently the acting director of the Thai Packaging Center. It's Tista. The floor is yours, Dr. Patra. Please go ahead.
Good afternoon. My name is Patra Manisin. I am the Deputy Governor, Industrial Service, Thailand Institute of Scientific and Technological Research, Thailand. Currently, I am also the Secretary General of the Asian Packaging Federation, or the APF. Today, I would like to tell you about sustainability in plastic packaging in post-pandemic. What is the industry doing, especially in Thailand? First, I will show you some case study. First, I would like to tell you about the fact in ASEAN about the plastic waste. It was reported 5 ASEAN members, including Thailand, are the world's top ocean polluter. Indonesia is the world's second largest producer of plastic waste after China, contributing around 3.22 million tons annually. The Philippines generates around 1.8 million tons of plastic waste every year. Thailand is currently the world's 6th largest source of plastic polluting the ocean, with 1.03 million tons each year. Plastic waste in Thailand account about 2 million tons, has approximately as approximately 12 of total waste. The government has taken a proactive approach by initiating the roadmap of plastic waste management in Thailand since 2018. Here, this slide also shows you the Thailand roadmap on plastic waste management. The goal of the roadmap is to stop using plastic capsule on water bottle, also degradable plastic and microwave in 2019. Secondly, we expect to free from 36-micron thickness plastic bag, polystyrene food box, plastic straw, and single-use plastic cup in 2022. Finally, 100% of plastic waste will be recycled by 2027. All the targets had to be met, and the plan had to be reviewed and monitoring. Then the government will adjust the action plan in order to achieve the goal or the target objective. Take a look at the packaging trend before versus after COVID. Before COVID, the government had already implemented the 3R concept, including reduce, reuse, and recycle, in order to reduce the number of plastic waste. Source reduction of petroleum-based plastic and replacement by environmentally friendly renewable material has been conducted. The government and private sector had encouraged to reduce reusable packaging or container. For example, in the coffee shop or restaurant, they provide some discount if you bring your own package or container. Then single-use plastic are also banned in some countries. In Thailand, some supermarkets not provide any grocery bag anymore. So if you want to go shopping, you have to bring your own bag. After the COVID, there is growing demand on e-commerce market and delivery service, especially for food products. Due to lockdown and work from home, so people don't want to go out in order to get infection. Unfortunately, there is an increased demand for single-use packaging with Thai seal in order to ensure product hygiene and safety. Some store, some department store or restaurant or food service do not accept reusable package because they're not sure that the package has been infected or it can contaminate with some virus or bacteria. Plastic waste increased during the lockdown up to 15%, or up from around 5,500 tons a day to 6,300 tons a day in Thailand. In addition, there also have an increased demand on both supply and demand for biodegradable packaging. There are some new startups produce new material or import some new bacteria that can biodegrade in order to use for food, beverage, and also personal hair care products. Some fact about single-use plastic bags. When we implement the campaign Every Day Say No to Plastic Bag, the plastic bag used in January alone dropped down to 3.75 billion plastic bags a year. But after COVID, the single-use plastic bag increased For example, Thailand produce about 2 million tons of plastic per year, and Thai people use on average of 8 single-use plastic bags a day. Across the globe, 5 trillion plastic bags are used a year, or 160,000 bags are used per second. You will see that only 12 minutes that you use the plastic bag, it takes up to 1,000 years for a plastic bag to break down. So we need some measure, we need some method in order to take care of all single-use plastic bag or container, such as plastic cup, straw, and tray. I would like to introduce to you the successful model in Rayong province, which is located in the eastern seaboard in Thailand. Public-private partnership for sustainable plastic and waste management, or PPB plastic, has been established in 2018 by more than 36 members from private organizations such as PTT Chemical, Dow Chemical, SCG Chemical. The goal of this project is to expect that within 5 years, at least 10% of plastic waste in Rayong will be recycled and generate at least 3 million Thai baht income for the local community. By 2022, zero plastic waste will go into landfill in Rayong. By 2027, reduce marine plastic debris by at least 50% and 100% of plastic waste to be recycled. Municipality will design the waste management system for their own area for maximum efficiency and sustainability. This is show the successful project that integrate between government, private sector, and community in order to work together. When the plastic waste come to the community or the province, they start collecting it first and then sorting into each plastic. For clean plastic waste that can be recycled, that the community can sell it into the plastic recycling plant. We use the model of circular economy. But the plastic waste that cannot be sold, the contaminated plastic waste, we go to the Rayong Provincial Waste Center and landfill, and they can go to incineration for the RDF for electricity power plant, and the waste that cannot be used will go directly to landfill. Another way that we try to resolve the problem of plastic waste is by using or encouraging the use of biodegradable plastic. You can see from this figure, the demand of biodegradable plastic increased from 2017 to 2026. Besides that, from COVID-19 or the after pandemic, number of biodegradable also increased rapidly in this area, such as China, Australia, India, and also the rest of Asia Pacific. Several types of biodegradable plastic has been used, but how can we sure that the material can be biodegradable? We also have testing facility in Thailand, located in Thailand Institute of Scientific and Technological Research. We call that Biodegradable Testing Center. This facility also provides several tests according to the standard, such as ISO 17088, SAMD 6400, or OECD 301 for both the ready biodegradability or preliminary biodegradation, in order to ensure that the plastic material or container can be biodegradable. Since after they pass the test, they will receive the certificate, and then they can obtain the logo in order to ensure that the plastic packaging can be biodegradable easily or ready to biodegrade, even they put in the compostable or under the landfill. I am sorry that I don't have much time to talk today, and may not have time for answer your question. If you have any more questions, please feel free to contact me via email patra_m@tiscr.or.ts, or you can call me at 025779202. My office is in Bangkok and we locate in Pathum Thani province, and also have the Thai Packaging Center also located in Bangkok area. Thank you very much for your attention.
Thank you very much, Dr. Patra. It's a nice and interesting presentation. Thank you very much once again, for sharing the packaging industry's initiatives in terms of plastic waste management. Let's move to the last presentation. The last presentation will be presented by Josephine Tan. She's going to make a presentation on impact of COVID-19 on single-use plastic ban policies, delays, and reversals. Experience come from Penang municipality, and she's part of the Penang Green Council from Malaysia. The floor is yours, Ms. Tang. Please go, Jo.
Yeah, good morning, good afternoon, and good evening to all the friends and participants that join us today. Before I start the presentation of the day, I would like to thank you, UNEP and AIT, for inviting me to share the policy, the campaigns, and of course, the local activities that Penang State Government is focusing, especially on single-use plastic. And yes, undeniably, pandemic COVID-19 has hit the world badly. And from the perspective of health, economy, and of course, our environment too. The demand of single-use plastic has increased tremendously, and the COVID-19 pandemic threatens to further exacerbate the scourge of plastic pollutions that I believe that a lot of our speakers has shared just now. And yes, in Penang, Malaysia too, today face masks, PPEs for frontliners, face shields, single-use glove has become our daily necessity, and it's a must-use item ever since the COVID-19 virus intruded our life. So apart from the protective equipments, we notice in Penang too, the growth in e-commerce. The consumption behavior of public is switching to purchase online due to movement control orders, our lockdowns that we have it before. The shift of purchasing patterns has brings impact, especially increasing our plastic packaging. And sadly to say that now we are now having the new wave of plastic pollution. So however, in Penang, Malaysia, we believe that there is a challenge, there is an opportunity. So we must not stop right here today because of the pandemic. In fact, we should take more and faster steps to find a breakthrough to solve the plastic pollution today. So next, I will try to share a little bit on what Penang State Government has done and is doing this despite of this difficult situation during the COVID-19 pandemic. So Penang State Government is aware on the increasing amount of single-use plastic usage tremendously. Apart from essential needs from the medical frontliners or the PPE suits, face masks, glove, which is a must for us, but Penang State government think that there is another way of reducing other usage of single-use plastic, that is plastic bag usage. So Penang is also one of the first state in Malaysia that implemented No Free Plastic Bag Day since 2009, and we are also the first state that banned polystyrene. So in Penang state in Malaysia, you can't find any polystyrene packaging in Penang. So, and beginning from this year, from the 1st of January 2021, Penang state government has officially announced no plastic bags from Monday, Tuesday, and Wednesday. So Penang has made it compulsory for all the hypermarkets, supermarkets, retailers beginning January this year, because we believe that plastic bags is one of the categories of single-use plastic that we can look for. So all registered licensed shops and retailers are compulsory to follow this policy, and it is tied together with their business license under the Local Government Act. So our local council has make it a must requirement during the renewal or new applications of the business license. So the main purpose, of course, is to create awareness and to reduce the single-use plastic that sent to our landfill. So through a study that we have conducted, because no free plastic bags has been a 10 years policies in Penang, so we found out and reported that 76% of Penang people is supporting this campaign. Apart from that, Penang has increased the charges of each plastic bag beginning this year too. No free plastic bag day. So for this charge, this policy is applied from Thursday to Sunday. So it means that in Penang, you won't get any plastic bag in Monday to Wednesday, and in Thursday to Sunday, you will have to pay for each plastic bag. Previously, we have to pay 20 cent ringgit Malaysia for every plastic bag. However, starting from the 1st of January this year, you will have to pay 1 ringgit for every plastic bag if you wish to get one. So these policies is started from Monday to Wednesday, then it's applied to all shops, supermarkets, hypermarkets, shopping centers. So, yep. And for time being, this does not apply yet to wet markets and hawkers. Next will be the plastic straws campaign. We also implemented since the March of 2019, and currently it is regular routine check by our local enforcers and notice. This no plastic straw campaigns is basically no plastic straws upon request. So if in Penang, you won't see any plastic straws containers that you can get it easily from the counter. So you will have to request. Yeah, this is also to minimize the quantity of plastic straws that is harmful to the environment. Yeah, apart from that, Penang Green Council, in collaborations together with our Ministry of Environment and Water, also with MGTC, working together with a UNEP Sea Circular project. This is mainly in reducing marine litter by addressing the management of the plastic value chain in Southeast Asia. So this Sea Circular project is initiated by UNEP and COPSI, which is supported by Government of Sweden. So the main objective of this project that we kicked off last year is to prevent plastic waste leakage into terrestrial and marine environment. So as we believe that there is high risk of plastic waste escaping the current waste management system, and we need to ensure that less plastic is entering to the general solid waste stream. Apart from that, in this Sea Circular project, Penang Green Council has also introduced a program, namely Sustainable Neighborhood Development Program. This program is aimed to develop a sustainable neighborhood framework that is community-driven and focuses on long-term behavioral change. Because we believe that one of the ways to reduce the use of single-use plastic is to educate and change the behavior of the people. So throughout the implementations of the pilot projects, we implement 4Rs: reduce, recover, recycle, and repurpose. These are all the fundamental principles to be instilled in the heart of the local communities. So to further enhance and add values to communities, we have introduced a circular plastic kiosk in these communities to let the local communities to understand the value of the plastic waste. So these are some of the photos that we have carried out throughout this year. And yes, talking about public survey, Penang Green Council also studied a little bit and doing a public survey to investigate the impact of movement control order towards waste generation in Penang Island. So through the state recorded a reduction in domestic waste since the start of our MCO, but the majority of people felt that waste at home is actually in fact increased. One of the probable explanation is that as people are stay at home, waste produced enter the waste stream from a single point instead of various points. So on top of that, there has been a surge in online shopping and food delivery services. So people has been acquiring more single-use plastic by the week, and this has derailed the state's initiative in curbing single-use plastic. So overall, findings from the survey demonstrated that the COVID-19 pandemic has remarkably changed the consumer behavior. So this is important for us to take the heat of public opinions as they follow and allow identifications of critical elements that form the foundation in developing effective strategies to tackle this problem. So as one of the initiatives to find an alternative for all the single-use plastic packaging, Penang Green Council had worked together with the private sector in providing paper food containers to the hawkers. This is mainly to reduce the single-use plastic usage and packaging during the pandemic. In terms of educational, food take-away packaging, we have also introduced a series of Hokkien channels and all the videos focused mainly on e-commerce and packaging waste. These videos will teach our local communities on how to reduce and reuse their own parcel and reuse their packaging materials to prevent them from becoming a single-use item. Apart from that, we have also come up with a series of online awareness campaign created during our pandemic period to cultivate the public awareness on environmental conservation and how to use plastic waste, upcycle it to the product. So we have come up with a mass education tool with a lot of public service announcement and educate people. Please dispose your mask responsibly. In terms for that, we have come up with our own sustainable face mask. This is a cloth mask sold by single mother and housewife. Next, I will talk about way forward, that what are the policies and what are the plannings that Penang State Government has been introduced throughout the pandemic. First, Penang Green Agenda. Penang Green Agenda is initiated by Penang Green Council, started in 2016, to look into sustainability aspect of Penang, including developing sustainability indicators. So this agenda serves as a framework for the Penang State Government to combat, identify the current and future environmental challenges of the state by proposing some feasible solutions. One of the objectives is to formulate strategies which will help to meet future environmental challenges in Penang while also incorporating UN SDGs. And most importantly is to adapt and build resilient communities in Penang by the year of 2030. It consists of 10 working groups reports in there. And one of the much more related to single-use plastic is the waste industry policies, which under our green economy working groups. Waste industry policies is in planning stage currently in Penang, and basically it aims to elevate the status of the sector to one that can enjoy a range of policy incentives that will include investment, research and development, labor and trainings, as well as incentive for indigenous businesses. So these waste industry policies will also address the whole of the supply chain from upstream by focusing on packaging standards and material choices from our producers to downstream disposal or reuse of the waste. So the main purpose is to reduce the material footprint of Penang and also to create new jobs opportunities and business opportunities to the local people. And also for this year, Penang State Government is planning to have our first Penang Waste Management Roadmap. The objective is to reduce total waste generations, achieve waste-related targets by using recycling, promoting circular economy within the sectors, low carbon development, waste to energy, and of course to create a waste industry policies that I mentioned before, stimulate research and development solutions, create a platform in order to facilitate the achievement of other major policies such as circular economy, renewable energy, and also it's very crucial for us to identify the innovative financing model for the waste sector. So essentially, governments need to apply a climate-friendly development filter to all spectrum of economy and also to introduce carrots and sticks to shift production and behavioral changes. For example,
wrap up, please.
Yeah, will be the last stage. For example, government can introduce a carbon budget. Carbon budget emission trading schemes, and government can also introduce minimum standards for both production process and products, and also mandate the recovery of material to achieve a closed loop of circular economy. My last slides will be, this circular economy. We did have a circular economy roadmap by our local council introduced, mainly that one of the main targets is to tackle the single-use plastic pollution. So we have 3 main targets that we have to comply. Formulated ERP by the year of 2022. Secondly, implement ERP policies by the year of 2025. And of course, elimination of single-use plastic by the year of 2030. So as a conclusion, we think government supposedly to play a very vital role in set the tone and to craft a policy to have a clear vision and directions for all the main players in our business sectors. So we share the same sunlight and air, so we have to share the same passion in protecting our Mother Earth. So it's never too late to act. Even small little step will be able to bring great impact. So thank you very much, Prof.
Okay, thank you very much, Joe. I think it's a very nice and interesting presentation where you clearly indicated the COVID-19 has made a significant impact on food packaging waste, especially in Penang, etc. I think let's move to the last session of this one. The last session is a Q&A session. Considering that we do not have a lot of time, what I would like to suggest is I have already shared the most of the questions are raised by the participants through the chat line and also the pre-registration to each of the resource persons. So I expect the resource persons will provide the answers and we will share that answers through our web link. Maybe I'll give you the last opportunity for each of the speakers to summarize in 1 minute as essential message they would like to share with the participants. Just a one-line message, maximum of 1 minute. Let me start with Dr. Kojima. Can you like to share something, please?
Yeah, thank you very much. I have not touched on the issue of the challenge of the waste management in ASEAN countries. Especially the relatively low income countries. Many local governments may not have a good waste collection system right now and the proper disposal. So it is very important to, enhance the capacity of the local governments in rural area or small cities to expand waste management services. Yeah, that is that is very important for preventing COVID-19 pandemic and also the to reduce the leakage of plastic to the ocean. Thank you very much.
Thank you very much, Dr. Kojima. Let's start next with Ms. Chang. Would like to say something?
Yeah, I think it really is, this challenge is really huge, and no one party or even few parties coming together could really solve it very easily. And I don't think that there's one single solution. However, I do think that the more people come together, especially with governance, with suppliers, with vendors, with platforms like ours, I think there's a whole lot to be gained in terms of what each of us are best placed to do, and so I hope there will be, you know, greater cohesion in the push for a solution.
Thank you, Iris. Let's move to the next. Mr. Ramon, would like to say something?
Thank you so much for this opportunity once again. I think as we move from pandemic to recovery, and as we are spreading widely the benefits of the vaccine, we should continue to rethink the way we do things and how much of the on plastics have become dependent upon. And healthcare has a key role in playing that leading anchor of sustainability in communities, and we're proving that, and we would want to work with different sectors to showcase this. So thank you, and let's think of reducing plastics even as we do now our massive vaccination. Thank you.
Thank you very much, Ramon. Let's move to Terry.
Thank you, Professor Visu. So I emphasized a lot in my talk the importance of segregating healthcare waste at the source, because the entire management chain, you know, downstream is optimized with good segregation. But I also want to come back to another important point that I made in my talk. I'm sure right now that the bilateral donor agencies and the multilateral banks are preparing to hand over to the member states autoclaves and incinerators to deal with the problem of healthcare waste. And we have been through this before with the swine flu pandemic and with the avian influenza pandemic. Shame on us all if we merely hand over those units without putting in place adequate systems to ensure the long-term operation and maintenance of those units. Because many of those units that were just handed over, you know, maybe with a ribbon cutting ceremony, they're now useless. And we cannot let that happen again. So I want to emphasize that point very strongly.
Okay, thank you very much, Terry. Let's move to the last one. Joe, like to say a few words?
Yeah, thank you very much, Prof, for that. I think just now I mentioned a lot in my presentation, in my sharing. And yeah, I think it's time for us to differentiate between needs and wants, and what is necessary for us and what is not necessary that we might have to avoid to creating a lot of waste. So it is never too late to act, and even small little step will be able to bring a great impact. So it's time for us to step back and think what kind of future that we want. And it is not a waste until you wasted it. Thank you so much, Prof.
Thank you very much for all the resource person. Let me move to the last segment, the wrap up and closing remarks. Let me start with, we had more than 350 participants who are registered. approximately around 175 participants participated in the webinar. It's quite interesting. At the same time, we had more than 500 Facebook followers. So once again, thank you very much for all the participants. As I said in the beginning, I assured we will share all the information in the webinar, including the question and answers and the comments and etc. So you will never miss any of the valuable information. Now I'd like to thank the 7 of the eminent resource persons. I think they volunteered, they came and participated. I think it is excellent. A lot of inputs, a lot of data. We have been working on this domain. It's difficult to get quantifiable data, and I'm very happy these people came and shared this experience. I also like to thank from AIT side, Mr. Ashim and his team who helped us to coordinate this program. Now, as a concluding remark, AIT is currently preparing this report, COVID-19 and plastic plight. Okay, this is part of the work we are doing with UNEP. And this document will be ready by somewhere end of June, which looks at the plastic waste during the pandemic, especially on different sectors, starting with the municipal solid waste, food e-commerce, and normal e-commerce, healthcare waste, etc. The different sectorial wise. And it also gives the recommendation, the research direction, and etc. So please keep in touch. So we'll be more than happy to share this document once it's finalized. Once again, I think I thanked everybody. I thank UNEP also. Thank you very much. Let me close this session. Sorry for taking you late. And we're going to have some group photograph. Ashim, please come. Can you kindly switch on your videos on the cameras, participants, so that we can take a group photo? Whatever information.